So how long does pain last after a knee replacement? Here's the truth. The worst is the first week or two. Most people are dramatically better by 6 weeks to 3 months, but a little swelling or occasional ache can linger for up to a full year. If you understand that timeline going in, the early weeks are far less frightening because you know they're the hardest part and they will pass. I am Dr. Corey Calendine, an orthopedic surgeon in Franklin, Tennessee. This is my independent clinical perspective, and it's not a substitute for advice from your own surgeon. The first week or two is the hardest part, and it's supposed to be. This is real surgery, and swelling and inflammation peak early. This is when you lean on your pain plan. Use ice with a barrier so you don't cold burn the skin. Elevate the leg. Do those gentle early motion exercises that your team asks for. It is uncomfortable. It does not last. By 6 weeks to 3 months, the turn comes. The swelling is dropping. The sharp pain gives way to duller soreness around activities and maybe during therapy. This is usually when people start saying what I love to hear the most after knee replacement. They say, "Why didn't I do this sooner?" Just don't rush the comparison to anyone else because everybody's turn comes at a little different week. Then there's the long tail, and this is the part people are not warned about enough. A new knee keeps improving for up to a full year. It's normal to have some swelling after a big day, a little stiffness in the morning, or when the weather changes, and occasionally an ache that fades. That is not a problem. That's the knee still settling in. Track your progress month to month, not day to day, because the day to day can be pretty noisy. Here's a principle I tell every patient. Pain itself does not mean damage. Working through the discomfort of therapy within reason is not hurting your knee, it's how you get better. Your body will prefer some activities and not others, so do more of what it tolerates. Start slow, almost insultingly slow, and build from there. You can say no to any one activity, but you have to say yes to something. Now the part that matters the most. Normal pain slowly improves over weeks, and it responds to your plan. Call your surgeon if the pain suddenly gets worse instead of getting better. If you have a fever, or if you have redness that's spreading or drainage from the incision, or if you have new calf pain or swelling, those are not part of the normal timeline and they deserve a same-day call. So how long does the pain last? It's worst early on, but much better at 6 weeks to 3 months and fully settling out at about a year. It'll improve the whole way. Be patient with yourself. Track the trend and not the day. And keep your eye on the life waiting for you on the other side. If you're weighing a knee replacement and want to talk it through, find a surgeon, or you can follow this channel for more videos like this. Thank you for watching.